Folks, thanks for joining us today. My name's Sean Dubas with Premier Marketing, and we'll be spending the next 50 to 60 minutes or so discussing what we feel is an important concept as we roll into marketing for AEP and then the enrollment periods from the 15th through the 7th. We want to partner with carriers that can deliver upon a package of benefits that address the needs of our population that we serve, the Medicare beneficiaries, but we also want to make certain that we're working with programs that can deliver upon the electronic support and all the lovely marketing aspects of our world that puts us in front of people in order for them to have us as an option for their coverages moving forward. Today's presentation is being recorded, and that recording will be sent to everyone who has raised their hand with interest on today's program, but it is also posted on our website at premiersmi.com and on our YouTube channel. You'll notice in the software package that there's a section for both questions and chat. We ask that you put your questions in the questions section. We find that we cover them generally through the course of the presentation, but we want to make certain that we address any inquiries that you have in order to be comfortable with the information you're being delivered. That said, let's start with a little bit of level set as to who Premier Marketing is. We're a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform. There are offices across the country. We're licensed in all 50 states. We act as an insurance wholesaler working through independent insurance agents such as you, and do so through contracts that are at the highest possible commission levels with recruiting contracts available to those who qualify. We offer these programs through a complete portfolio of products that include Medicare programs such as what we'll discuss today with Medicare Supplements and the other coverages that you have for the base medical for Medicare beneficiaries, the Medicare Advantage and the Part D prescription drug programs. But we also offer a full portfolio of life insurance and annuity products, final expense life insurance, pre-need plans, and long and short-term care programs, disability income plans, and ancillary benefits that'll be part of our discussion as well today that go into the programs that cover the additional needs of folks that don't have this sort of coverage on their base medical. And that includes dental, vision, hearing programs, critical illness cancer plans, hospital indemnity programs, telehealth. We even introduced an accident policy as well. When you look at the Medicare Advantage programs, that portfolio is large and robust, carries the national carriers for you and many of the strong regionals that can make a difference for you in your market. And that same philosophy carries over into the prescription drug plans where those national carriers are there for you through our organization. Is that the contract for these programs are part of the MA programs, the Medicare Advantage plans, but we want to make certain that you have the ability to offer drug coverage for all of the folks that you visit with, including the folks that have integrated medication coverage through their Medicare Advantage plan, but also those that need that because they are accessing additional benefits to cover the shortfall on original Medicare through Medicare Supplements. And you see that we have a large portfolio of these products. We want to make certain that we have also the marketing support to make you successful in this area. And that's one of the reasons why we invited our guests today to visit with us. When you look at the ancillary products in each of those categories, you have the national leaders there. And these programs are not only a means to cover a strong need of our prospects and clients, but they give us an opportunity to market in a different fashion and the opportunity to create additional revenue streams to ourselves and to our agencies. Importantly, these are intended to cover the needs of our prospects and clients because a lot of these are expenses that they couldn't budget for otherwise. And we realize that as we go into the overall marketing opportunity for Medicare, and you hear of the aging of the baby boomers, the silver tsunami, the one every 10 seconds, 10,000 plus a day. But if you look at Medicare based just on age, we're off a little bit because there's an increasing number of folks that are working past the age of 65, not immediately accessing all the benefits they have available through Medicare, participating fully in that program. They're not, for one reason or another. And while this can be a fairly significant percentage of that portion of the population. It's more than made up for by the folks that are under the age of 65, accessing their Medicare benefits because of disability. And many of the programs that we discussed today on the ancillary side, particularly, are of great help to this population as well. And we need to keep in mind that portfolio of programs that are available to us, making them available to our Medicare beneficiaries is very important because they've got challenges with their health. 2/3 of them have 3+ chronic conditions. They have some challenges with their income and their assets in many cases. So we want to be able to present programs that can help them get the coverage they need at a premium they can afford, because it's one of the choices they have to make as they come into Medicare. Folks that are eligible for Medicare can actually decline the Part B coverage should they choose to do so. Most don't, but many of those folks then will self-insure for the medical portion of it and perhaps pick up a standalone Part D program for their prescription drug plans. The majority of people, however, will go one of two other avenues, perhaps pick up a standardized, modernized Medicare Supplement plan, a Medigap program that can help them with the medical coverages and add on the Part D program. And then other folks are going the Medicare Advantage route, where they're bundling coverages into a singular program offered by private insurance companies in this instance as well. We want to make certain we can cover folks regardless of the choices that they make as a Medicare beneficiary. And we see as they come into the program, into the Medicare program, that it's a fairly even split between Medicare Advantage and Med Sup. This is a survey from Deft Research. I need to get actually some updated numbers here on it for you, but they're pretty close as to what route they're taking. And we still have that portion that are showing as original Medicare. And this can include folks that are dual beneficiaries, the folks with Medicare and Medicaid, the folks that are accessing care through the Veterans Administration, the VA. They may be people that have coverage because of benefits that are provided to them in their retirement from the company they work for. And it includes the folks that either made a decision to make a decision and stayed on original Medicare, or the folks that didn't make that decision and landed with no additional coverage by default. We want to make certain we take care of all these people and be able to communicate to them in a language they understand. And so the whole segment of our society that speaks Medicare, well, they throw out a whole lot of acronyms. And as agents, we find ourselves doing that as well. We need to make certain that we're communicating well with the folks we visit with. And sometimes that requires a little bit of help when it comes to what does MOUSE mean? Well, Mickey is not far away, but the link to this acronym guide will come to you as part of the follow-up as well. So as we enter into a period of time in the year where we have a lot of intense marketing activity in the Medicare world through the annual election period, we need to be mindful of the other times of the year that we can write business and whether or not these lock-ins actually apply to the products that we're discussing. Because the standard programs here, it depends on what other coverages they have as to when they can change and that sort of thing. And there are all the special election periods, those SEPs that people can access, be they standard SEPs or the things that we see because of weather or other certain special circumstances. Regardless, people aren't looking at their benefit package that they have as a retired individual or whomever. Well, in this case, Kaiser Family Foundation tells us 57% of the Medicare beneficiaries don't review or compare their coverages annually. So that's why we as agents have an obligation, in a manner of speaking, of reaching out and helping people understand the coverages they have and the possibilities they have moving forward, because a good portion of the folks that don't understand that information or aren't actually comparing it are people that are particularly vulnerable. So we want to make certain that we help them. Not that we don't want to help everyone, but we also want to make certain that the folks that are looking at the different programs help them understand what is available. And that includes choices within choices. And it can be very complicated for the layperson who doesn't understand everything about Medicare. And that's where your role is especially highlighted, because they're not even using the government sites or the government information to understand their choices. We also want to be able to deliver this information in the manner in which the person wants to receive it. So sometimes you still have some paper people out there. They want things in kits or not. But regardless of how the initial information is delivered, if it's tactile and they can feel it and smell it and taste it, or we send it to them electronically, many times we then need to be able to pivot into a virtual presentation for a follow-up or for a close, or in many cases, some people, that's the way they want it up front. And we've trained people over the last year and a half, society as a whole, to be able to receive that information electronically. You see it with the doctors and the specialists, even hospitals and dentists, faith-based organizations. Many pieces of a person's life now comes electronically, and it'll never go back to the way it used to be completely. So if we have a partner that can help deliver the information electronically, oh, excuse me, help us enroll electronically, it can really help. And so we've asked our friends with Medico to come in and visit with us about their programs and see how this particularly applies to you and the beneficiaries that you visit, because they have a very broad portfolio and great marketing support. So our guest speaker today, Ms. Melissa Gwennap, is a regional sales distribution manager with Medico, and I'm going to turn control over of the presentation to you, Melissa. And gee, I need to update some pictures, it appears, on our slide, but here we go.
Yeah, I was thinking I looked a little bit young in that. Whew.
Looking good.
Not that young anymore, John Dubois. I'm getting older, you know. All right. Well, thank you. We appreciate it. Thank you to everyone who's joined us. We're getting ready to come up on that AEP acronym, right? So we want to make sure that we are powered with all of the information that we can get. So just a little bit of information we're going to go over about Medico. Again, John, Premier, thank you. We appreciate your partnership. We have been in business for quite some time. So good news is your clients will be taken care of. Really, your strength, we strengthen our partnership. We love our partners like Premier and all of our agents. We value everybody in the field. We've been in business since 1930, so we are not new to this market. Medico is going to be your partner in the senior market, especially to get you through AEP. And today we're going to kind of go over what Medico all has to offer for you as an agent. And by the way, if you guys are not contracted with Medico, please get with Premier Senior Marketing or your marketer there and get appointed. It literally takes about 7 to 10 business days to get your active agent number with Medico. If you are appointed, then you're good to go. The thing about Medico is you don't have to do any extra certifications, no extra training. Simply get appointed, and if you're appointed, you're good to go. So the first product we want to talk about is Medicare Supplement. So we know right now in the Medicare market, a lot of people choose Medicare Supplement. Some people choose Medicare Advantage. Well, here at Medico, in all of the states in dark blue and this lighter looking blue is where we offer our Medicare Supplement products. So brought brand new into the market August 1st and September 1st. Household discount here at Medico looks a little bit different than every other plan you might see out there. Medico's household discount simply states as long as the client lives with another individual over the age of 50, so 50, they automatically get a 10% household discount. Now, as far as Medicare Supplements, what we offer is going to be Plan A, Plan F, Plan G, Plan N. We also have high deductible F and high deductible G. Underwriting, the cool thing about Medico is our service. Hands down, you can call in and talk to an underwriter on your case. You can talk to somebody in claims. You can talk to our agent support team. We don't third-party anything out here at Medico. We have 2 offices. One is in Des Moines, Iowa, and the other is in Omaha, Nebraska. But as far as underwriting goes, if you have a question, you need to check on a health condition, a medication, please give our team a call. They would love to walk through what your situation might be. So one of the things about Medico, if you're selling our Medicare Supplement, and you're selling it across states where our new product rolled out, number one thing is you're going to see Medico very competitive in pricing for your client. However, also at Medico, we've got generous commissions. We actually raised our front end of commission by 2 points starting August 1st and September 1st. We have consumer marketing materials. If there's something you want specific to Medico, it's all out on our website. But what does your client get from being a Medico client? Obviously, they're going to get very competitive rates, okay? The rates are absolutely amazing. But one other thing that Medico did recently is they are now getting a bundle and save discount. So if they buy a Medicare Supplement with Medico and they buy a dental plan that we're going to go over next, they're going to get a discount on their dental premium. Also, once your client gets through underwriting, they are good to go. Medico doesn't look back at any pre-existing conditions. So as long as they qualify through underwriting, they are good to go. Medico is also an A-rated company through AM Best. So again, financial futures for your clients is a positive, okay? So really quick, I talked about that bundle and save. So one of the things that we kind of learned during the pandemic, and as we start to maybe get a little bit through this pandemic, we're starting to see people's smiles again, right? One of the best things about my job is I get to usually be in live person training. So it's exciting to see people's faces. But one of the things that we don't think about is how important good oral health is, for all over health. So as we know, poor oral health is linked to a lot of health situations, whether that be diabetes, heart disease. There's studies now showing that it's linked with Alzheimer's disease. Again, we want to make sure that our clients are taken care of. Now, you're probably going to hear me say this a few times throughout the presentation, but your clients don't know what you don't tell them, okay? So how many times have we been on a turning 65 appointment and the client is so excited because now they're going on Medicare and they absolutely think they're going to be covered for everything? Happens all the time, right? So it's our job as the agent to make sure we are educating our clients. We are now the teacher, okay? We've got to teach them what is out there. So Medicare Supplement, Medicare Advantage, generally they have a good idea of what they want, but they don't know things like this product that we're going to talk about exists, okay? They just don't know. So the product that we're going to talk about today is all of the states in gold. So if you're a state in gold, this is the product available. Your client has the freedom to choose any dentist they want, okay? Medico pays the claims exactly the same. We do not care. However, we do have a network available. If they do want to go to that network, they will get some additional savings at the time of service from the dentist. Now, Medico pays the claims exactly the same, whether it's in network or not, so we don't care, okay? 2 different plan options, very affordable rate. Who can you target? Anyone ages 18 to 89, so it doesn't just have to be your Medicare market. First day coverage on absolutely everything. We will go over that. There's also 2 riders that the clients can purchase. There's a multi-policy discount, but I wanted to talk about that multi-policy discount really quick. So if you have a client who is buying a Medico Medicare Supplement, or they already have a Medico Medicare Supplement, and they want to add a dental plan, they're going to get 5% discount on their premium for the dental product. And by the way, the dental product is very simple and very affordable, and we'll go over pricing here in just a minute. So 2 different plan options that your clients can choose from. One is gold, one is platinum. The only difference besides premium between gold and platinum is the basic services, and I'll touch on that, okay? However, on gold and platinum, $0 deductible for preventative services. So for what you and I go to the dentist for every 6 months to a year, there's no deductible, no waiting period. Medico pays 100% of their evaluations, their cleanings, and whatever x-rays are due, okay? Now, basic services, if somebody needs a filling or they wake up with a toothache and need an x-ray or they need a non-surgical extraction, there is a $50 deductible for basic and major services. If they purchase either the Gold 1000 or Gold 1500, Medico will pay 50% of the charge, okay, up to either the 1000 or 1500. Now, Platinum, as you can see, pays 80% of basic services. This is the only difference between the two plans. Major services, no waiting period on major services. However, if the client has to have a major service done within the first year, Medico's only going to pay 20%, okay? After they've had the policy for a full 12 months, Medico will actually pay 50%. And what are major services? I always say that's things we don't want to go to the dentist for, okay? Bridges, crowns, dentures, surgical extractions, threaded root canals, periodontal service. And this word that starts with an I, implants, they are covered under this plan. Now, I will tell you, I don't care if you live in Iowa, where I'm from, or Texas, where John is from. If you're 18, you're 65, or you're 89, the pricing is exactly the same, okay? Don't care if you're male or female. Price is exactly the same for everybody. The Gold 1000, and I'll make sure I send some information to John and he can stick it in the handout. Gold 1000 is $36.80 a month. Gold 1500 is $46. Gold 1500 is $46. Platinum 1000 is $39.79 a month. So for less than $4 a month, they can get 80% coverage. Now, I'm not a math genius, but to me, I think it's worth it. And then the Platinum 1500 is $49.78 a month. So basically, you can offer your clients dental coverage anywhere between $36 to, let's just round up to $50 a month, okay? Now, there's two riders they can buy. Now, they do have to buy this at time of application, and they can only buy one or the other. The first benefit is the buy-up benefit. This adds $1,000 to their policy every single January 1st. So instead of having $1,000, if they buy the buy-up benefit, they're going to get $2,000 or $2,500. Also, we have a carryover benefit rider. The carryover benefit rider allows the client to carry over any unused benefit from 1 year to the next. There is no, they can carry it over from year to year to year up to $3,000. The $1,000 buy-up benefit rider is $11.95 a month. And the carryover benefit, which by the way is sold 50% of the time, is $7.97 a month. So great options out there for your client. The next product I want to touch on is very important if you are selling Medicare Advantage. How many of us on the line sell Medicare Advantage? Okay, probably most of us. But how many of us cross-sell a hospital indemnity product? I'd venture to say probably less than half, okay? If you are not selling hospital indemnity or talking to your client about this product, you are doing your client a huge disservice, okay? And you guys are leaving a lot of money on the table for yourself. So there's a household discount. All of the states in blue is where this product is offered. The household discount, if they live with another individual over the age of 18, they automatically qualify for 7% household discount, okay? Simplified underwriting, there's 9 knockout health questions, okay? Who can you target? Anyone ages 40 to 85. So again, doesn't just have to be your Medicare market, maybe somebody on the ACA, someone who has a high deductible through an employer, or guys, what about if it's somebody who doesn't have insurance at all and they want to get some coverage? Okay, this is who you can target. You can talk to people during a Medicare Advantage sale about hospital indemnity. Just make sure you add it to the scope of appointment. However, if you have somebody who is a DSNP client, they cannot purchase this policy because these are tax tax-free cash benefits paid to the client, and that could, mess with their Medicaid benefits. So we don't want to do that. So the base plan, there's 5 base benefits built in the basics, okay? There's one benefit that your client has to choose. And what they have to choose is, if they go inpatient into the hospital, how much do they want Medico to pay them per day that they're in the hospital, and for how many days? So you can choose anywhere from $100 a day all the way to $600 a day. You can increase that in $25 increments. And what I've kind of been seeing nationally, if somebody goes inpatient into the hospital, they have to pay about $325 a day, okay? I don't know about you guys, but I don't want to pay $325 a day to be in a hospital that A, is usually stinky and has terrible food, right? I would much rather Medico pay for that, not me. And the thing that I like to talk about really quick is our average 65-year-old couple only has about $6,000 in go-to savings. This is not retirement, 401k, investments, anything like that. That is just money sitting in a savings account. As an agent, challenge those clients and say, okay, you come to me because you want a Medicare Advantage plan. It's usually $0 premium or very low dollar premium. However, you do have a maximum of out-of-pocket that you have to pay first. Are you willing to dig into your savings account and pay that to the hospital? They're going to look at you like you're crazy, okay? I promise they will. So, again, hospital confinement, anywhere from $100 to $600 a day. Medico always pays day one. They can choose if they want Medico to pay 6 days, 7 days, 8 days, 9 days, 10 days. We also have a 21 and a 31-day option. That's the only choice they need to make on the base plan. Observation down, everything is automatically built in the plan. Medico pays 100% of the inpatient benefit if they are coded under observation. Guys, this is huge, okay? Emergency room, we'll pay $150 per emergency room visit, up to 4 visits per calendar year. Now, they do have to be admitted within 24 hours. Transportation and lodging, this is a big benefit that nobody realizes is built into the plan. This will pay $100 a day as long as your client is receiving inpatient treatment in a facility that is more than 50 miles or more from their home. $100 a day for 10 days. That's a $1,000 benefit built in. Inpatient mental health, we keep hearing this is on a rise. That pays $175 a day for 7 days per calendar year. Base benefit, your average 65-year-old client, 65-year-old female with a household discount, $250 a day for 6 days. Average premium is about $15 a month, okay? I don't know if you guys have been through Jimmy John's drive-thru lately, but you almost can't buy a value meal through there for $15 a month, okay? Riders. Of course, now we've got riders. This can help you personalize the coverage. Now, is every client going to buy every rider? No, they're not, and that's okay. But what's not okay is we're not talking about it. So the ambulance rider pays $250 for 4 ambulance rides per calendar year, okay? So $250 for 4 rides. Outpatient therapy and chiropractic rider, it'll pay $50 for either 15 or 30 days for outpatient therapy. And then the get one free portion, I call this buy one, get one free, is the chiropractic benefit. Medico will pay $50 for 5 chiropractic visits. Now, 15 or 30 days for outpatient therapy, sell 30. Why I say that? It's less than 80 cents a month, okay? Skilled nursing, we pay days 1 through 50, either $100, $150, or $200 for the first 50 days of skilled nursing. Outpatient surgery rider, they can purchase $250, $500, $750, or $1,000, and we pay for 2 outpatient surgeries per calendar year. Lump sum cancer, I hate this C word even more than COVID. Cancer statistics are insane, and we'll talk about those in a little bit. But on this rider, they can purchase anywhere from $1,000 to $10,000. If they are diagnosed with internal cancer or malignant melanoma, Medico will send them a check, okay? We don't care what they do with that money. Urgent care rider, 4 times per calendar year, $50 per urgent care visit. Lump sum confinement, this is just additional money they get to put in their pocket if they go inpatient into the hospital. That's either $250, $500, or $750. 9 knockout questions, okay? Very simple. Medico does not do a telephone interview, no prescription drug screen. Very simple. Okay, so I know we just talked about this ugly C word, okay? On our hospital indemnity, they can purchase a rider, okay? And it goes up to $10,000. However, we also have a standalone cancer product, okay? This basically says the client can get more money. So the minimum amount on the standalone cancer policy is $10,000, $15,000, $20,000, or $25,000. There's only 3 health questions on the application, no family history questions asked. You can target anyone ages 18 to 89, and cancer statistics are unreal, okay? 1 in 2 men will be diagnosed with cancer in their lifetime. 1 in 3 women will be diagnosed with cancer in their lifetime. No tobacco question asked, no family history question asked. Your client will more likely claim on a cancer policy than claim for a house fire. Guys, this is crazy. But the thing about cancer is, I remember when I was a child, if somebody was diagnosed with cancer, it was an automatic death sentence, right? Not in today's world. But what it can do is it can financially affect a person, okay? It emotionally affects them, but it can financially affect them. So again, if they want to purchase this policy, we will simply send them a cash benefit that's tax-free of $10,000, $15,000, $20,000, or $25,000. They can do whatever they want with that policy. Now, all of us on this phone call today know somebody who's been affected, whether it's a family member, ourselves, a neighbor, a coworker. It is absolutely everywhere. So don't forget to talk about these products. Now, here at Medico, the only way that you can submit an application is through our My Enroller tool. This is our quoting and application processing system. Super simple, guys. This takes you 5 minutes. You can do this on a desktop. You can do it on a laptop, a tablet, an iPad if you're a Mac user. 3 different ways we can collect signatures if you're face-to-face, fine. If your client wants it emailed, or you can also do a voice authorization. You're basically bypassing the data entry process, and it is getting issued immediately, okay? Super simple. We can walk you through it, not hard at all. One last thing I want to talk about before I pass it back over to John is Medico's incentive. And I don't know about any of you on this line, but none of us are doing this for free, right? And I have teenagers at home, and all they really care about is money. So I always say that my husband and I are bank of mom and dad, right? But you can earn unlimited bonus money. So starting right now, okay, through the end of the year, if you write an underwritten Medicare Supplement application, all you have to do is write 3 to qualify. You will get paid $150. Hopefully we're all sitting down, okay, because we're paying $75 for open enrollment and $75 for guarantee issue applications. Who does that, okay? As of tomorrow, because tomorrow is October 1st, we will also start paying an extra $25 per application if you submit a combo sell. So if you submit a Medicare Supplement and a dental, you're going to get $175 for the combo if it's underwritten, or $100 with the combo for open enrollment or guarantee issue. Guys, this is unlimited. I about fell over. You guys can make a lot of money. This is our entire sales team here. If you have any questions, obviously this is my updated picture. I don't look so young anymore, right? Then we've got our national sales director, Kelly Rayburn, and our internal, who has to keep track of Kelly and I because we travel a lot. God bless her soul. Courtney. So if you need us for anything, please do not hesitate to contact us. John, that is all I have for today, so I will pass the horn back to you. Thank you, everybody. If you have any questions, please feel free to type those in, and I'm happy to answer any questions you guys have. I appreciate it, and happy selling during AEP.
Great. Thank you, Melissa. We've got a couple of questions that pertain to the great state of Montana. And the first one, Reggie's asking if Medico will start offering Medicare supplements there now that it's no longer a unisex state.
That is something we are hoping to do. So we're not rolling out any new states right now for the rest of the year. We are hoping to get in every state by the end of 2022. So we will start going back to all of the states in January.
Awesome. The other question is about some of the ancillary portfolio. I saw where the cancer program is available in Montana. Reggie's also asking about the dental program and its availability in Montana.
It is not available there yet, but we are hoping that it will be. Hospital Indemnity is, though.
There we go. And I think that's an important component. If someone's selling MedSup or Medicare Advantage, obviously more likely with a Medicare Advantage sale, but a hospital indemnity program Medico offers is a great program. So thank you. I am going to pull some information back, or pull the control back, and start with just to finish up with a few slides that we have about why you would want to do this program, work with Medico through Premier. And part of what we offer is an ability for you to showcase and store your information about yourself in an insurance program called Insurance Bay that allows you to create an agent profile, answer questions about your past and the different qualifications you have in order to contract with different insurance carriers. And we want to make certain that we have that available to you so you can store your, contract electronically with a number of different programs out there. In many cases, the carriers are all participating in this. Some are not. I shouldn't say all. So we want to make certain that we're delivering electronically the opportunity to contract with programs, including Medico, moving forward. A nice piece as well that we offer is discounted errors and admissions coverage to qualified agents. What makes you a qualified agent? Well, you got a contract with us. What this does is enable you to control your own errors and admissions coverage. It's not like being added to a blanket E&O for one program and then worrying about what you're going to do for the rest. This is a program you own and can take care of you regardless of whom you contract through and regardless with whom you contract. We do also bundle different continuing education programs through our association with WebCE, enabling you to keep your license up to date at discounted prices. And you can actually take out and enhance your own benefit package through a modified guarantee issue disability income program that you share a commission in. So you're adding to your own benefit package with DI coverage, nice acronym, there for you. Much as where today's presentations being recorded, past presentations have been recorded as well, and they're on a variety of topics with the different carriers that we meet with, like Medico, also with different marketing programs that can put you in front of people to offer their programs. And this is a nice way of making certain that you have access to this resource 24/7. As I mentioned when we started, on our website and on our YouTube channel, these recordings are available to you. We also offer complimentary access to our Medicare Center program to agents that are contracted with us. What do you mean by that, John? It's free access to a quote and enroll tool that many people will use with different segments of the Medicare population. It has 3 different enrollment tools in there that are powered by Connecture, Sunfire, and CSG, all available through a universal login. It enables you to collect that scope of appointment electronically through different means and store it for that 10-year period that's required, whether you sell it or not. It also has a CRM function where you can manage your lead flow and your prospects that are part of it, and a resource center in there to help you with different questions that might arise through the course of your discussion with beneficiaries in the field. It's, again, all available without cost to you. And one of those programs that's in there, the CSG program, Melissa mentioned the fact that hospital indemnity programs are a strong sale during the annual election period, all year round, of course, but particularly applicable to Medicare Advantage programs. This compare and fill in the gap piece of this software package can actually help you designate, okay, I've got an MA program here, it's got a hospital copay of this is how I fill in the gap. And Medico makes a great option for you through this system to do just that. We talk about cross-selling a lot simply because it brings a lot of advantages to you and your agency. But one of the key things that it does, in addition to increasing the referral process, is the fact that the more product you have in a house, the better your retention for that customer is going to be. Your persistency grows up. It doesn't necessarily mean that they all have to be with the same carrier. They just have to be with the same agent, and that's you. So you can have a Medicare Advantage plan with one of the carriers that offer those programs and offer a hospital indemnity program, a dental vision hearing program from Medico. You get 3 products in the house. Look, your percentage of your retention goes up greatly. We also want to make certain that, as Melissa mentioned, all these nice incentives that carriers offer, the magnitude of the programs that are out there with Medico right now, as Melissa said, you kind of, wow, I can make a lot of money just on the incentives. We have those all listed on our website in a singular place. In many cases, these incentives will help you qualify for carrier trips. We know how that may or may not happen with the current pandemic. And regardless of that, many of them will help you also qualify for premier incentive programs that we have going. One of the things we want to make certain that we do is get you in front of people so you can talk about these opportunities. And so a contact list is available to you if you're comfortable with Ma Bell and you smile and dial. Keep in mind, you can't cold call for MA or PDP products, but you sure can for MedSup. You sure can for dental vision hearing programs. And we see a lot of agents that are using dental as a bridge of the population they speak to fill in their T65 funnel, that turn in 65 opportunity that everyone speaks of, that I mentioned early in the presentation. 10,000 plus a day. Are you getting your share? There's a way to reach out and do it compliantly. And we also have community-based programs to make certain that you maximize those opportunities in the field. That includes the retail marketing programs, the Medico program. You have different programs offered by individual carriers in that area as well. But we also want to tap into those centers of influence in the community. And that includes those faith-based organizations, different providers. When you look at faith-based organizations, they are looking for people that will discuss different programs and make it available to their congregations in a non-threatening and informative manner. And what you have with Medico is a portfolio of products that you can discuss together, individually, to this population and make them aware of the fact that they don't have to settle for just a small dental program that may come with their Medicare Advantage plan. They can add to that with a standalone dental program that'll add to those coverages. And when we talk about marketing with providers, there are a ton of docs that don't want to completely affect their payer mix and want their patients to be on Medicare supplements in certain situations, regardless of how they contract with the MA plans. Having the information available from carriers like Medico can make a difference in this area too. And keep in mind, not every provider is part of a network. We also have the opportunity to visit with carriers and work with them about having a little problem with my speech today, with the prospects that they are generating. So we want to make certain that we get you in that flow. We also have different internet and direct mail support programs. And a part of what you will receive as follow-up will include the referral system that can help you multiply the leads that you have regardless of where they come from. The direct mail program is two-pronged. It has one based on production on health products, another based on production for final expense programs. So you can qualify for this twice, deeply discount the cost of your mailings, and see the returns that you have with consistency on direct mail. It's like an exercise program. You do it once, you're going to feel a little bit of pain might see some results one way or another, or you do it consistently. That's where you're going to really see the value of these programs come to fore for you. We do offer these through vetted preferred lead vendors. That way we make certain that we protect you on a compliance basis. All of these partners in this area have CRM systems, so as soon as someone returns a lead, you have it immediately. And that's that hot lead that can make a difference for you. And we do that through these lead vendors. We also have programs, however, that can help you if you choose to just purchase mail responses. These vary in price by type and by area and by time of the year. But what you're receiving there is a direct mail response that's never been touched, really fresh. It's not same day as if you did the campaign. These are direct mail leads that the folks remember sending them in. You know how this works with direct mail. Sometimes, yeah, I think it's going to work. And the folks say, I didn't send anything back. These, when they're hot, like they are, it gives you the opportunity to maximize the return on your investment and to help as many people as possible. That same philosophy carries over into our internet lead programs, where we have them set up on Facebook for both final expense and Medicare. These are programs, however, that are microwave, is what I'm going to call them. If someone's responding to a lead on Facebook, they may be responding to multiple outreaches. It's imperative on an internet lead that you respond to them very quickly, because they may be someplace else by the time you touch them otherwise. That referral program I spoke of, that's part of the sales process. Well, part of the sales process is going back to your book of business and asking them for referrals. Tie this concept in with the use of Medicare Center so you can actually effectively conduct year-over-year analyses and ask for your book of business for referrals as well. Still have to follow the rules of do not call, but you can get people then in your pipeline that wouldn't have responded in any other fashion. All this said and done, we do this because we want your business. We want to be referable to you, and we want to make certain that the programs that are offered are part of your personal marketing plan. You're putting them in play quickly, and you're moving forward to make certain that you're maximizing the opportunity you have, not only during AEP, but all year round. That's one of the reasons we invited Medico to speak with us today, is the fact that their programs, one, don't require the additional certifications. You're probably all certification sick by now. They're not subject to lock-in. You have different marketing guidelines that apply to MedSup and ancillary products. Don't require the scope of appointment and are easy to implement. So putting them in your portfolio and moving forward is a great way to add to your overall business. So all that said and done, I'm going to check questions one more time to make certain that we covered them all. And we have. I ask you to reach out to us at Premier at 1-800-365-8208. Speak with the marketer that you've been visiting with, or if you're new to our organization, we'll set you up with a subject matter expert in order to make certain that we cover your questions and make certain you have what you need moving forward. You can reach us as well through our website at premiersmi.com, reply to the email that we're going to send to you, and follow up to today's presentation. The only thing I've got left right now is to thank you. I appreciate you coming on today's presentation, visiting with us, listening to us, and investing your time. It's your most precious commodity. I thank you for that. For those of you that have done business with us, I thank you for that business. For those of you that are about to, I thank you for that as well. So until we're able to visit with you once again, I wish you good selling, and thank you so very much. And thank you, Melissa. We appreciate your help.
Thank you.